few criteria on a piece of paper and say, yeah, if you tick these boxes, you can actually choose euthanasia at the age of 18 because of depression, I find that to be very complex and dangerous. And the other thing I want to say is that this discussion involves a broader political discussion. Like, really, you need a few weeks for that stuff. And what's happening in the world, in my view, is some form of a neoliberalist move in which they are creating crises all the time. Our beloved narcissistic, sociopathic, neoliberalist leaders around the world. And as such, they have created an assault on humanity. And we are confronted with this on all fronts, including our sense of self. So here we are, we're offering a lifestyle that causes a lot of suffering. We then offer medications that sometimes enhance the suffering, and now we're offering the solution, which is to choose to die. And if we choose to explore our consciousness in some other ways, it's illegal. How is that even making sense? And I think we should fight for it. We should not take it as is.
Either illegal or very, very expensive. Anyone else choose to? No? All right. So yeah, we will go over to the audience. Is there anyone out there that does have a question? Yeah.
Just speak up, shout out. Shout out.
I'll shout out. Are you an MDMA practitioner in America? Is that yourself that had that on the biography? Yeah.
Yeah, so I was just asked if I was an MDMA practitioner in America, and yes, I have received the training, and so I have done it, but I do not do it here in Australia.
I see.
It is highly illegal.
I'm really fascinated that there's a whole practitioner protocol about that. I'm a mental health nurse myself, so I'm used to the prescription of psychiatric medications and giving them to patients and stuff. And I find the highly, like, it's so interesting to think about the psychological, the psychedelic therapy that's being offered within this context of like constant monitoring and then integration afterwards. You know, in no other medication is that there, you know, like I've seen a lot of very strong medications just prescribed and we don't really even know if they took them or not, or they took them according to instructions. It's just such an enormous gap. So I find that interesting. I'm really fascinated by a lot of things that you're saying, but that particularly strikes me. Yeah.
I think that's an excellent point you're making. That I guess the response is that the clinical researchers who obviously have a view to translating to clinical practice and are very supportive, intrinsically supportive of these approaches, have been exercising what we might regard as an excess, but certainly an abundance of caution in terms of really establishing the safe framework, the safe container for these experiences. That may or may not change. It may change quickly or slowly. We don't really know at this stage, but it certainly has to be reiterated and reinforced that the TGA's guidelines at the moment absolutely specify that they can only be taken under, psychedelics can only be administered and taken under supervision. And given that, although there's been a general sort of maybe a little bit of hype and hysteria about the positive outcomes, there's also an increasing part of the conversation about the potential for negative outcomes and longer-term negative outcomes. And so I think that's really incumbent on us. It's our responsibility as clinicians and researchers to ensure that the safest possible framework can be put in place. It might seem onerous, but I think it's probably the best way to go at this stage anyway. And it's also, I think, it's an abrogation of responsibility, if that's the right word, for people who might be working outside the current legal framework not to exercise the same duty of care.
I don't think psychedelics can be compared to any other currently used psychiatric medication. I mean, yeah, we give out a lot of very strong drugs, but the experiential nature is just chalk and cheese, like completely incomparable. So I think that there is that need for that framework for these clinical populations, or at least for some framework, be that necessarily a medical model or whatever else. But I think there is a need for that framework to exist, and I just think the experience of these substances is so different to any of the other medications that are currently used. I don't think they can be readily compared in that regard.
Absolutely. I'm sure it's very helpful for the patient wanting to take something, to have that companionship and that chance to think about it more. I'm sure that's very helpful. I'm just really interested.
Yeah, question up the back.
Shout out.
The question was, is it critical or obligatory essentially for participants in clinical trials to be drug naive or psychedelic naive? I can say no, not necessarily. It really depends on the specific trial. Certainly in studies of psychedelics in healthy populations, which were generally the phase 1 studies to first to check safety and then what they call pharmacokinetics, so the way the drugs behave in a human body. Generally, it was preferred that participants be psychedelic experienced, because it was thought that if they had some sense of what they were getting themselves into, in fact, they would be in a better position to give fully informed consent to participate in the study, and that the psychological effects of those would be sort of somewhat anticipated. And because the psychological effects weren't the main focus of the research, then it didn't really matter whether they had expectations or not. That has changed now as we've moved into phase 2 and onto phase 3 studies. These phase 2 and 3 studies are in what we call clinical populations, so they're treatments for a specific condition, usually a mental health condition such as depression or anxiety or PTSD, or even though PTSD, it's debatable whether that's a condition. But all that said, then generally it's preferred that the participants be psychedelic naive, because otherwise expectation or expectancy can become a confounding factor and a significant challenge to the effective conduct of the research. Now that we've had books such as How to Change Your Mind and a lot of media exposure of psychedelic assisted therapies, that has also generated a lot of expectation on the part of participants. So in some ways it's almost impossible for anybody to, just as it's almost impossible for people to join be a part of a jury trying the former president of the USA for certain misdemeanors and naughtiness, it's also almost impossible to find people who don't have some sort of expectation of psychedelics and psychedelic assisted therapies. So good question, it's complicated.
Can I just come in on that? That will not be an expectation in the North Coast. Otherwise, we might have quite a small trial. But, however, having said that, it will be an expectation, and this will be part of the protocol, that there will have been a significant period since the last time that you took a psychedelic. And I'm not quite sure whether it'll be like 3 months or 6 months, but it'll be of that kind of nature. The other thing I just want to say while I've got the microphone is that we do have a flyer here for anybody who'd like to just keep in touch with the trial. We're not, we haven't gone through ethics yet. We're not taking anyone in at this point in time, but we have a email address. So if you'd like to, I've got flyers here, and Judy, who's there with her hand up, has flyers. So if you'd like to get hold of one, we are here, and we'll be at the back of the tent after this.
Awesome. Thank you so much, guys. That's actually all we have time for today. But thank you again, gentlemen. I really appreciate your time, as always. All right. Thanks.
So we've got saliva testing coming up, everybody. Thank you for the expert panel of speakers. You're so interesting.
I hope you mean you're not actually testing this one.
Yes, we'll be testing everyone's saliva for MDMA, ketamine. It's all coming up. We have the experts. Then we've got some psychedelically aware speakers coming after that. Then mushroom cultivation, psilocybin cultivation workshop. Don't miss that one. You all want to see the mushrooms, how to cultivate them. Then pathways to legalization. Then Kane Barlow again on psilocybin or psilocybin fungi in Australia. He's a brilliant talker. And then we've got Marijuana Australiana movie tonight. Thank you, everyone. Saliva testing coming up.
Thanks, guys. Thank you so much.
Always. Were you in the back?